Hi, this is Dr. Priyanka, Chief Dentist from Smile One Dental Care Group of Dental Clinics. I'm here to explain about the dental care in kids. So, dental care in kids starts from the birth itself or even before the birth. For a pregnant woman, it's very important to take right nutrition and right amount of calcium because the growth of the teeth starts when the baby is in the womb itself. So, provided the mother takes right amount of calcium, the calcium goes through via placenta through the womb to the baby, and as well the teeth development takes place well. If in pregnancy the calcium supplements is inadequate, the teeth development also will be not proper. So right nutrition and adequate amount of calcium supply during pregnancy is very important. And immediately after birth, right from the birth to 6 months, baby will be having milk. So even though there are no teeth, it is important to maintain the hygiene of the gums. The gum pads will be there in the teeth, in the oral cavity, wherein the mother, what she needs to do is just need to wipe with the plain finger after every feed, such that the bacteria doesn't stay over there only. If the bacteria stays over there, it leads to poor bad breath. So in order to avoid all that, after every feed, the mother just needs to wipe with the finger the gum pads. Then after 6 months, the first teeth starts to appear at the age of 6 months. The lower front 2 teeth starts to appear. It's the first indication that we need to start brushing. Many people ask me, doctor, when do we need to start brushing? 6 months is the first age group we need to start brushing. So at the age from 6 months to 1 year, we just need how to brush is what I'm going to tell you. You just need to wipe around the finger with a gauze cloth around the index finger and just wipe around the teeth. Rub the teeth surfaces such that any debris which is stuck to the teeth will just go off. Next, after 6 months to 1 year, from 1 year onwards, we need to start using brushes. And for kids, there are like age appropriate brushes. Adult brush should not be used for the kids. So depending upon the kids' age, they will be classified into below 1 year brushes are available, 1 to 2 years, 2 to 3 years, and 3+ years. They are classified and they are written on the label on the brushes. So identify those and use age appropriate brushes only. So while brushing, use a fluoridated toothpaste such that the fluoride content will go into the teeth and it will act like an anti-cariogenic property. So use a pea-sized toothpaste upon the brush and then encourage the kids to start brushing. So if the kids are like, you just need to brush them outer side and inner side and just ask them to rinse it off with water. If in order to encourage the kids brushing, there are variety of musical brushes and motorized brushes available, so that it will be like a fun activity for the kids and they'll be happily enjoying the brushing. Just follow these brushing techniques and use the age appropriate brushes such that the oral hygiene will be maintained. And when is the indication that you need to visit a dentist? Follow up with the dentist every 6 months, or whenever there is a white spot, it indicates that it's the first cavity, on the enamel surface the cavity forms, it appears like a white spot. So usually people miss out that, and at least you can identify when it progresses into a blackish discoloration. Whenever there is blackish discoloration, it means that there might be some cavity. Or if the child tells that they have a food lodgement, means it also indicates that there might be some problem with the teeth. So if there is food lodgement, means for sure there might be some cavity. So it's the time for you to take the kids to the dentist. So initial blackish discoloration or this food lodgement can be taken care with just a filling. So the further you delay the things, then the kids complaint of pain. Whenever the kids complain of pain, either it could be due to tooth fracture or it could be the caries which has progressed very extensively such that it has involved the nerves, and in that situation just a filling is not sufficient. We need to do a pulp therapy called pulpotomy or pulpectomy, which is similar to the root canal treatment like adults. So whenever kids complain of pains, probably a pulp therapy would be required. So after the pulp therapy, a stainless steel cap would be placed on the teeth such that the protection will be there throughout until the age of 13 to 14. So the teeth procedures are required for the kids. Usually people neglect it only deciduous teeth. Why anyways milk teeth are going to fall off is what the misconception people have in their mind. But just avoid that misconception. The milk teeth are also very important as well as the permanent teeth. Do take and visit regularly the dentist. Take the kids to the dentist once in every 6 months or once in a year, and do a regular follow-up. Thank you.